Welcome to the Answers for Cancers podcast. Today on the podcast, we are going to be discussing the hormonal therapy letrozole. So what we will discuss is what is letrozole, how does it work in the body, about some of the side effects that you may experience, and also how is letrozole taken. It's important to note that this podcast should be used in conjunction with the written information that's available within the app and any additional information that has been given to you by your treating team. So to start us off, would you mind telling us what is letrozole and how does it work?
Yep, so letrozole is a hormonal therapy drug used to treat breast cancer. It's used if you have estrogen receptor positive or ER positive breast cancer, and it's used to reduce the risk of early breast cancer coming back or to control breast cancer that has come back or spread to other parts of the body, known as secondary breast cancer. So hormones are chemicals that our bodies make, and they act as messengers and help control how cells and organs work. So hormonal therapy drugs such as letrozole are drugs that change the way hormones are made or how they work in the body. So many breast cancers rely on estrogen to grow, and this is why it's called estrogen receptor positive or ER positive breast cancer. So estrogen is produced mainly in the ovaries before the menopause, and after menopause the ovaries no longer produce estrogen, but a small amount of estrogen is still produced in the fatty tissues, muscle and skin. So this happens using a type of protein or an enzyme called aromatase. So letrozole works by blocking this enzyme to reduce the amount of estrogen in the body, and this is a type of drug called an aromatase inhibitor.
That's fantastic. And I would just wonder, would you mind talking us through some of the side effects that people may experience while they're taking letrozole?
Yeah, of course. So one of the most common side effects is hot flushes and sweats. So hot flushes are a really common side effect of this treatment. During a flush, your neck or face may feel warm or look red, and flushes can last anywhere from a few seconds up to 10 minutes. So you may have sweats and then afterwards feel cold and clammy, and some people report feeling really anxious or irritable during a hot flush, so this is a really normal side effect. So there are some practical things that you can do to try and reduce flushes, such as wearing clothes made of natural fibres, such as cotton, wearing layers of clothes that you can remove if you feel hot, using cotton bed sheets and have layers of bedding that you can remove if you feel hot during the night, keeping room temperatures as cool as possible or using a fan where necessary, and having cold drinks over hot ones, or to try and avoid drinks with caffeine in them where possible. So you may experience fewer hot flushes and sweats as your body adjusts to the hormonal treatment. However, if this is not the case and the hot flushes are impacting your day-to-day living, you do need to communicate this with your team, as your doctor can prescribe drugs to help with this. And flushes and sweats usually stop after a few months of treatment. However, for some people they may continue. And again, this is just about having an open line of conversation with your team, so to ensure that they can support you as best possible. Moving on from that, tiredness and fatigue can be a common side effect of taking letrozole. So what we would say is to try and pace yourself and plan your day as best as possible to make sure that you give yourself time to rest. Gentle exercising, like short walks or strength training, can help give you some more energy. However, if you do feel like you want some more tips and tricks on how to manage fatigue as best as possible, the Answers for Cancers have a great podcast with Dr. Deirdre Connolly, who goes into this in a little bit more detail. It is important to mention that if you do feel sleepy or excessively tired, please do not drive or operate machinery at this time. Muscle or joint pain is also a common side effect of this treatment. So if this is happening, please do tell your doctor or nurse, and they can give you painkillers if necessary. However, practically, being physically active can help with the pain and keeping your joints flexible, along with maintaining a healthy weight as well. However, if the pain does not get any better, again, do communicate this with your nurse or doctor, and they can look at pain relief if necessary. Bone thinning, also known as osteoporosis, is also something associated with this treatment, and it's usually after several months or more of taking this treatment. So having osteoporosis or bone thinning can increase your risk of a broken bone or fracture. So you may have a bone density scan to check your bone health before or during your treatment. However, this is at the discretion of your treating doctor. Doing regular exercises such as walking or strength training can improve your bone health, along with eating a healthy, balanced diet. Your doctor may prescribe drugs called biphosphonates to help protect your bones. However, this is usually based on a bone density scan, and it's at the discretion of your treating doctor, and it's not prescribed for everybody. They may also advise you to take calcium or vitamin D supplements during taking this treatment. However, we do not recommend anybody to start taking supplements without having a conversation with your treating team. Something else that is also a common side effect of taking letrozole is mood changes. So if your mood is low or you have feelings of depression, you do need to talk to your cancer doctor, your breast care nurse, or your GP. It is very normal to have feelings of low mood after a cancer diagnosis, so it can be really difficult to differentiate between this or low mood that's associated with hormonal changes. The most important thing to remember is to not struggle alone or in silence. Do communicate changes in your mood with your treating team to ensure you receive the best support possible, and your doctor or nurse can refer you for counselling or talk to you about medications that might help. Feeling sick or having indigestion or tummy pain is also something that can be associated with this medication. However, it is usually very mild, but do let your nurse or doctor know if it is happening. You can try taking letrozole with food or at night time to help avoid this. But again, if it's not being resolved, it is something that you need to talk to your team about, as they can prescribe medications to help. Moving on from that, letrozole can increase the level of cholesterol in your blood, and this is a fatty substance that is found in everybody's blood. So you will have a blood test to check the level of cholesterol, and your doctor will organise these tests for you and let you know how regularly you need to have them. It can also have effects on how your liver functions. Again, this is detected by a blood test that is organised by your treating doctor. And again, just to mention, the frequency of these blood tests to check your cholesterol and your liver function is at the discretion of your doctor. You can also experience changes in your taste and have a loss of appetite while on this treatment. So if you don't feel like eating 3 big meals a day, we would recommend to try eat smaller, more frequent meals or snacks instead. Some people also report experiencing a bitter or metal taste in their mouth while taking this treatment. So sometimes sucking sugary-free sweets can help with this taste, or to try different variety of food to find out what works best for you. And these symptoms usually stop after the treatment finishes. However, if you are struggling to maintain your calorie intake or struggling to keep your weight, you do need to report this to your treating team, as there is access to dietitians within every hospital that can help you. Hair thinning is also something that can be associated with taking letrozole. So, however, this is usually mild. But if it is something you're worried about, again, report this to your doctor or nurse. And if you want some more information on hair thinning or alopecia, the Answers for Cancers podcast has a really informative one where you can get some tips and tricks that might be able to help you with this side effect. Skin changes can also be a side effect of this treatment. So your skin can become dry, itchy or flaky. So we would recommend using an unperfumed moisturising cream every day. But do tell your nurse or doctor if you do notice any significant changes to your skin during this time, such as a rash, as they may be able to give you advice or prescribe creams that can help with any significant skin changes. Any skin changes usually improve when the treatment finishes. Headaches and feeling dizzy can also be something people can experience while on this treatment. However, this is more rare, but it is a significant side effect that does need to be reported to your treating doctor or nurse, and they can investigate this further if necessary. And if you're feeling significantly dizzy, we would recommend not to operate any machinery or drive at this time. Weight gain, again, can be something that can be experienced with this treatment. We recommend eating as healthy a diet as possible and maintain physical activity during the treatment. However, like we said before, there is access to dietitians within every hospital that can help give you some more information on nutrition. And also there is access to some physical activity or exercise programs for people that are on hormonal or anti-cancer treatment. So you can just speak to your nurse or doctor that can help refer you to these services. Moving on from that, vaginal bleeding or dryness or changes to the vagina can be a side effect of this treatment. So you may experience bleeding when you start the treatment or if you change to it from a different treatment. If bleeding does continue for more than a few days, you do need to report this urgently to your nurse or doctor. In terms of vaginal dryness, you can use non-hormonal creams, gels, or lubricants to help with vaginal dryness or any discomfort you may experience during sex. However, the most important thing to note here is that any products that you use must not contain any estrogen. So you need to ensure that they are non-hormonal based creams, gels, or lubricants. And it's important to have a discussion with your doctor or pharmacist before you start to use any products. You can experience issues with diarrhea or constipation while on this treatment. So in terms of diarrhea, this means that you're passing more stools than is normal for you, or having watery or loose stools. Or if you have a stoma, it will be more active than usual. So if you do have diarrhea, we recommend to drink at least 2 litres of fluid each day. Avoid any alcohol, caffeine, or milk products, or foods that are high in fat or high in fibre at this time, and contact the hospital for advice if it doesn't resolve, as they may be able to give you some medications to help improve this. In terms of constipation, so this means that you are not able to pass as much stool as normal for you, or it may become difficult or painful. So some tips if you're experiencing constipation is to drink at least 2 litres of fluid each day, and to eat foods high in fibre such as fruit and vegetables and wholemeal bread. And also doing regular gentle exercises like going for short walks can help with constipation. However, if you do have constipation, do contact the hospital for advice if it doesn't resolve with implementing the tips and tricks above, as your doctor can give you some medications called laxatives to help with this. Letrozole can also have an effect on your nervous system in some instances. So you may experience pain, numbness, or tingling in your hands and feet while on this treatment. And these symptoms can be caused by carpal tunnel syndrome, which is caused by pressure on the nerves in the wrist. And it's also important to mention that we are aware that in some cases, people have had previous anti-cancer treatments that can cause symptoms and side effects such as peripheral neuropathy, which can leave a long-lasting numbness or tingling in your hands and feet. So we are aware that it's very difficult sometimes to differentiate between what's old numbness and what is new numbness. And this is why it's really important to discuss this with your team, as they can help you assess this regularly to see if this is a new numbness caused by your hormonal treatment. It's also really important to mention that for anybody starting any new medication, there is always a small possibility that there can be an allergic reaction. So some signs of allergic reaction can be feeling very hot or flushed, having a skin rash, feeling very itchy or shivery, or feeling dizzy, or having a headache, or feeling breathless. So if you do feel unwell or have any of these symptoms or signs while you're taking this treatment, you do need to tell your doctor or nurse straight away, and do not take any more of the treatment until you have spoken to them. So some other important information to mention about this medication is that if you have a cancer diagnosis or you're on anti-cancer treatment, both of these things can increase your risk of developing a blood clot. So symptoms of a blood clot include throbbing pain, redness or swelling in your leg or arm, suddenly feeling breathless or coughing, or sharp pain in your chest, which may become worse when you cough or take a deep breath. So if you have any of these symptoms, do contact your hospital straight away on the 24-hour contact number that you've been given. And if you can't get through to this line, please do present to your nearest accident and emergency department. A blood clot is classed as serious, however, it can be treated with drugs that thin the blood that are known as anticoagulants. So some practical things you can do to try and help reduce your risk of developing a blood clot is staying active during your treatment, and also drinking plenty of fluids each day, especially water. Although it is important to note that it's not anybody's fault if they develop a blood clot. The tips and tricks just given above, like staying active and drinking fluids, are just things that can help reduce it. But it is being on anti-cancer treatment is the cause of increasing the risk of having a blood clot. Moving on from that, letrozole does contain lactose, which is the sugar found in cow's milk. So do report to your doctor or nurse if you do have an allergy to lactose. In terms of contraception, letrozole is usually used when you have been through the menopause. However, if you have been recently through the menopause or are having treatments to stop your ovaries from working, putting you into a temporary menopause, there is still a very small chance you may become pregnant. So if you're sexually active, it's really important to not get pregnant while having this treatment, as the drug may harm the developing baby. And even if you have been through the menopause, your doctor and nurse will still recommend using effective contraception while you're on this treatment. It is also advised to not breastfeed while you're having this treatment or for some time after finishing treatment, as this drug can be passed to the baby through breast milk. And it's also important to note that if you're having any other medical treatment or dental treatment for any other reason other than your cancer treatment, do always tell both doctors involved, and that's your anti-cancer treating doctor and the team that are looking after you for any other medical condition, as it's really important that they are fully aware of all the medications and past medical history that you may have.
And to finish up, do you just mind telling us, how do you take letrozole?
Yep, so letrozole is a 2.5 milligram tablet that you take every day. It should be swallowed whole, and it can be taken with food or on an empty stomach with a glass of water. However, the starting dose can be adjusted by the prescribing clinician using their independent medical judgment, or to consider each patient's individual circumstances. And it's also just important to note here that while we've discussed all the common side effects of this treatment, if you're experiencing anything other